Thanks everyone for being here. Go ahead and you can move the agenda forward. I've got a few updates that I want to offer, and a couple of things I actually want to stop and talk about as we move through this morning meeting. Wanting to make sure that everyone understands, and I'm aware of it, Region 5 is aware, and I've heard it actually nationally, that there's an increase in incidents across the region and in Chicago, other states as well. But what that means is we definitely have to do our due diligence in our sites and making sure that we have our hands on what's going on with our staff. It is our recognition that the individuals who are in our classrooms as teachers, and we talked about this a lot when we were about to reopen coming back from COVID, that there is a lot of stress in classrooms, and we anticipated it and started off talking about mental health and brought in a trainer. We did some work around making sure everyone had staff wellness plans, et cetera, because we anticipated when we put individuals who themselves are stressed in classrooms with children who are also stressed and with you're seeing increase in behaviors, that's an opportunity for something to happen. And so I am reminding everyone this morning, for your sake and for the families that you serve and the children, that you keep your eye and your hands on what's going on with your staff. Have staff wellness plans in place, making sure staff understand that you understand the stress levels that are out there, and making sure that they understand they have contact for supports, and that there's mental health providers and other things that they can actually access so that they can get these kinds of services that they need for themselves. Many of these same individuals are parents who are going home, taking that stress home to their own children, and it then is showing up in your classrooms. And so we have got to get ahead of it, observing in classrooms, making sure that we know what is going on with our teachers, observing. And when we see that things are going left before there is something that occurs, what I am saying, and I've said it before, I said it back in 2019 when we changed our policy and we were able to be in each other's face in meetings, for example, that part of our role and responsibility is to have staff, if not ourselves, in there, understanding what's going on with the individuals in our classrooms, and where necessary, supporting them, and if we have to, moving them out of the classroom, instead of having someone else cover that classroom until we can get them to calm themselves enough to actually be in that classroom successful with those children. And so stepping in, observing, seeing, knowing, understanding, but getting ahead of it before something occurs is what I'm asking all of you to do. I know when something occurs, you've got policies and procedures, you're activating your policies and procedures and making decisions about the next steps and what you need to do. But I want us to really think and try to be proactive. Not to say that you are going to get there, and I'm not going to say that we are always going to be ahead of everything. But if we're not initiating systems and processes, that we're constantly in classrooms and making sure that we know what's going on with the individuals who are in there, then we're a step behind and we are leaving ourselves vulnerable. Leaving ourselves vulnerable means that we are having incidents that we got here with our Head Start Early Head Start grant previously, where we ended up having that grant go into recompetition. These kinds of incidents that I'm talking about, when a child is harmed, or if something happens in a classroom, a child is hurt, if we have a teacher who is inappropriately handling a child, all of those things are called child maltreatment. That is an immediate deficiency on any federal grant. And so I'm saying that out loud. I want everybody to hear this from my voice, that these kinds of things cannot continue to occur. We've got to do whatever we can, and we're going to be working more closely with all of you. Going to go all the way back and pull the lever off and say we need to maybe start over with what all we're doing. And the reason I'm saying that is because we have initiated a policy several years ago regarding reporting of incidents, where we require, DFSS requires organizations to immediately, same day of the incident, to communicate that to us. I am saying this to you because it is necessary that you contact us the same day. That's when we start our process of understanding exactly what's going on at your organization, and then we move to determine what else we need to do. Initiating that starts the process. If a child falls off a trike, if a child gets hurt, if a child is ill, we're asking all of those things to come to our supervisors here at DFSS so that we can then activate our process and do what's necessary. If you have questions, review your sales manual. For clarity, it talks about reporting, but we're going to send out more information again, and we're going to talk about this again and again and again. This is key to our success, key to your success. And when I'm saying key, it's about keeping children safe. That's what we're here for, is to provide safe, healthy environments for our children. And this is what we have to do. We're required and we're mandated to do just that. And so again, immediate same day to your team lead, making sure that you're CCing the supervisor of that is the assistant director, is Elaine Millsap Parker, making sure she CC Sheree Johnson, the manager. Put everybody on there so that we don't miss an opportunity to get your information. And if you want to, please CC me as well, then it's in my email box. But what we cannot do is not have the reporting coming in immediately and coming into us days later, because that's, again, an issue with Office of Head Start and the requirement for reporting, because we have a time frame by which we have to report. And when we're getting it late, then we're reporting it late to Office of Head Start. It just triggers issues, and we can get ahead of this if we work closer together. We will be doing everything we can to continue to support you. I know how hard this work is, but I need us to do also the piece of it about the reporting so that we can work with you. We're here to support, to find out what else you need, and we will be coming back to you again to find out what else. And we're going to have a meeting where we're going to specifically talk about these issues so that we can brainstorm and strategize. What do we need to do here in Chicago with our grants? How do we support you? Is there something else that we need to be doing differently? So more to come on that. Our CARES data system, it is our system of record. All agencies are required to use the CARES system. There are some that I have been able to go and I can find that you're using COPA. I can go all the way through and see that you're using it all the way through to doing your attendance, and even your case notes are in there. We moved into the CARES system in August of 2022, and we've been updating it. And yes, it is still in building mode. We're not 100% there, but we have always, since August, been requiring agencies to use the CARES system. And we anticipate, and I anticipate, that all of you are going to be in that system with all of your data. Some of the data that we did find in COPA, we've been working with our vendor to try to import that data into the CARES system. What that's going to mean is for the agency on the other side is to go in and do what's necessary to make sure everything is updated. And so we're going to be working with you on this, but we have got to get that system of record updated with all children's records, making sure their funding is attached to them. Again, it is our system of record and reporting. So more information on that. And we'll be following up with you, those of you who were using the COPA system, to make sure that you are able to update CARES for what we're transporting and importing in. Moving forward, and I do see some things coming up in the chat box, which I will go to as soon as I finish a couple of more updates, and then I'll go to the chat and start responding to some of those. We are in the process of everything for our FA1, Head Start, Early Head Start, and Early Head Start CCP. That FA1 federal review is happening the week of February 6th, so just a couple of weeks from now. I've been sending out emails requesting some information that's needed. I need all of that documentation to be sent to me by the 20th. I need to be able to go through it, aggregate it, and make sure that I can pull it into the report that I need for that review. If you have any questions, please reach out to me regarding the documentation that I've been asking. It's about your personnel records, making sure that I know what the credentials are for all of your teachers. I've also asked to have the background check information so I can aggregate that. And also lastly, I did ask for your quarterly child and adult food program report as well. That did go out as well. Any questions, please reach out to me regarding what I have requested of organizations. Next slide. And so I did add, and it's not in here, so I'm not going to go to this one, but I did add 2 other updates that I need to state to you guys. And one of those is you received, those of you who have Head Start and Early Head Start, you received a notification for cost of living increases. We need your governance documents. Those are due this Friday as well on 1/20/2023 by close of business. Again, you received your documentation acknowledging your increase in early Head Start and Head Start cost of living, where we raised also the rate per child, but those information, that documentation for governance is due by this Friday. If you have any questions regarding that, I ask that you reach out to either Raymond Barrett or Kathy Wiggins in our grants team. Again, cost of living and an increase that you received in the rate per child for Head Start, early Head Start. We need your governance documents. They're due on Friday. And if you have questions, talk to Raymond Barrett or Kathy Wiggins, who is in our grants team. I'm going to go to the chat really quickly. I see one question in here regarding CARES, and the question is about training for PI home base only. We've been trying to get everything into the system set up so that when you go in for home base, that you're able to actually do all of your detailed work in there. I will be verifying that all of that is being done, and then we'll get some training scheduled so that you're able to work within that system. We needed to have some information in there, as you know, when on your home base, the number of visits, socializations, all of those different things need to be updated in the CARE system in order for us to do effective training for you. I'm going to check and make sure all of that's done so that we can get those trainings set up so that we can assist you in utilizing CARES for those of you who have PI home visiting. I don't see any other questions for me in the chat. Tiffany, how are the sites to calculate quarterly attendance when that feature is not available in Salesforce yet? We do not have anything to compare to COPA's 201 report. And this is true. We're still working on Salesforce, and we're trying to work to do that. Only thing I can say to you is we will work internally to see if there's something that we can give you to work offline to get your quarterly information done. Tiffany, we will work on that and we'll get back to you on that one as well. You're welcome. Go ahead to the next slide.
Good morning, everyone. For program admin updates, we have some important CPPC dates. The Executive Council will be on Tuesday, February 7th, and the full council will be on February 21st. And Sarita already made the announcement for the cost per child increase. This is just a reminder of the documents. These are the attachments that need to be submitted. And you can submit this to the Head Start Early Head Start grant application, City of Chicago. Can you go to the next slide? If you have any questions, here's Raymond's information or Kathy Wiggins.
Hi, this is Craig Zemke with the DFSS data unit. I'm just like to give you the enrollment update for this month. Let's see, the Head Start enrollment looks pretty good for the first time in a little while. Although we're not, that should be 1489. And then I look at that, but it is in the 90s, and that's probably our strongest right now. As you can see, slowly our birth to 3 federal grants have been creeping up, but they are not as close to full enrollment as we would like to see, although, you know, again, we're making progress. I want to point out that these information is still based on the information that you have given our monitoring teams, and thank you for working with us while our system is a little wonky and getting that information back to our teams. If you look down at the state funding, we are basing that on the information that we've actually been able to upload to CPS through our partnership with them and to ISB. So I've noticed when I compared what if other information I have from the information that sites were being able to give to our teams again on that enrollment, that the numbers that we've been able to report are close, but they're a little bit lower than what we've actually been able to upload. So The difference here is that some children, we know that you have, we know that number is actually for PFA, for example, is right around 4,000. But in some cases, we are missing some information. And my team has been getting out there and contacting people, letting them know that there are required fields that we need to be able to upload. So if you received a request to do that, please go ahead and update that in the folders where we collected that information, and also let the team know that, because you may have gone in there and fixed, added missing address information or whatever it was. But if we weren't aware that it was updated, we probably didn't resubmit it. So, but again, we've got a lot of cooperation on this. So thank you to everybody who has been willing to get back to us and fill this out. Again, the numbers are creeping up there, but I feel we still have a ways to go. So everyone's keeping up, keep up your recruitment efforts, and let us know if there's anything we could do to assist in that.
Thanks, Greg. Good morning, everyone. I hope you can hear me. If not, just put it in the chat. I'm not going to repeat what Sarapa said. She did an eloquent job. She did a much better job than I would do, because I'd probably be a little harsher. But this incident reporting stuff is serious. It could be a reason that DFSS gets its grants in jeopardy. And none of us want to do that. I have included in the last few CSD updates the reminder of the new IM, that information memorandum that Office of Head Start has given to us. Any of you that attended the conference and went to the session, you'll know, for example, they've upped the reporting period. So they have not upped it, but they've said to us, within 7 days, you need to report this, which means you all have to report to us in a timely manner. And our reporting is, as soon as you give that information to DCFS, you're reporting it immediately to Elaine's team. So we've got to get this down. We've got to get our rhythm together, because this is immediate reporting. We can't take any hits on this. If you have any questions, reach out to us, but go through that IM. The other IM that I want to bring your attention to is for not necessarily disability services, but for health services. The Office of Head Start is offering a webinar to us on February the 2nd. And it's going to be dealing with those children with specialized healthcare needs, whether they have disabilities or not. We all know that we walk a fine line with our 504 plans versus individual education plans. So for those children that don't exactly fit into a particular box, that's what this webinar is going to address, and what we need to do to modify our curriculum, our materials, our services, to work with those families to get those children the services that they need. That may be an adjustment to the day for, I don't know, if the child has seizure disorder, we might have to work with mom to get the medication done before they come to school, or, you know, maybe during the school day. And we know that you're going to need extra supports for that, if that's the case. And so then at that meeting that you convene with the families, you talk through with a medical professional what that means for that child for that day. So I'm encouraging all of us to watch that webinar. And then lastly, there's another IM that I've been including in the CSD updates on, particularly the HASAC, the Health Services Advisory Committee. This is around Office of Head Start wanting each grant recipient to come up with a COVID-19 mitigation plan. And so we will be calling a special meeting, which I believe the date is January the 27th. And that link should have already gone out in the CSD updates for you to register. I'm really going to need your participation in this, because out of this special meeting, we'll be formulating a work group to help us to draft the mitigation plan for DFSS. So I know that was a lot, and there's a lot coming up that we're asking for your participation in. And with the HASAC meetings, remember, that isn't just staff, that's parents, that's local health professionals, anyone that has an interest and wants to be a part of these meetings. So thank you for your assistance. If you have any questions or you need any clarification, you can put it in the chat. If you're not receiving the CSD updates, you need to reach out to Martise and her team so that we can get you online with these updates. A lot of important information goes out that you need to be aware of. All right, and so with that, I have a question from Catherine and Tracy. Do we need to send the plan we currently have? We already have a COVID mitigation plan. Do you want us to rescind these? I'm going to say at this point, if you have not sent your plan, and I know what you're referring to, the one that you all did, I believe in 20, when we first started this. And it is based on IDHS licensing regulations. If you did not send those plans to us then, or if you have updated those plans, yes, send those plans to your monitoring team lead, either Jacinta or Nicole, so that we have them. And great, Catherine, you said that you updated yours as of June. Yes, if we don't have that already, please send it. Thank you. All right, with that, I'm going to turn it over to the next speaker.
Good morning, everyone. Few financial updates here. For FY22 expenditure rates, we have the Head Start grant. We're currently about 69%. Early Head Start, we're at 57%. Early Head Start CCP, 59%. EHS expansion, 55%. Please note that FY22 HHS invoices are still being processed, and FY23 budgets are pending processing. Therefore, there are no reported expenditures. Next slide. With the current expenditure rates for ECBG, we're about 17%. With CCAP, we're at 29%. Related to HHS FY22, our cursor CARES budget extensions are to 3/31/2023. Finance will extend the budget, extend the date on the current budgets. No revisions are needed. December 22 expenses will need to be reported on your accrual to your finance contact in order to meet comptroller closeout deadlines. Finance team will reach out to obtain December 22 invoice accrual in early February. For COLA revisions, DFSS finance team is sending notification of budget approvals to move forward with invoice submission. If you have not received notice by now, please reach out. All COLA and 2022 invoices must be submitted by 1/2023, which is tomorrow. HHS FY23 budget review is in progress. December 22 expenses will need to be reported on accrual to your finance contact in order to meet comptroller's closeout deadlines. Once your budget is approved in the system, you will receive the invoice in iSupplier. Finance team will reach out to finalize December 22 invoice accruals in early February. FY23 childcare. Invoices should be submitted through 12/31/22 period. Monthly invoice submission is required, and invoices related to 2022 period cover deadline is 1/20/23, which is tomorrow. FY23 PIPFA, those invoices should be submitted through December 31st, 22. Monthly invoice submission is required, and invoices related to the 22 period covered deadline is 1/20/23, which is tomorrow. I supply your training and reference material. It's a link on the PowerPoint. New site form requirement. It's information there as it relates to finance contacts. Anything dealing with Head Start, Early Head Start, CCP, and expansion, Laverne Coleman is your contact. Her email information is there. Corporate or RTL, Laverne is your contact. Her information is there. Childcare would be Selena Ruan. Her information is there. PIPFA is Sharon Davis. Monica Almanza has accepted another position with Senior Services Unit, so please contact Sharon until further notice. Also, in case you missed the email at the end of December, we have a new accountant on staff, Terry Lopez. So please continue to reach out to the above team members with questions or concerns until further notice. And I think that is it. Wait, is the purchase of a van allowable? So you know what? Email that question to your contact, and then we will get back to you. It was a direct message that came in, so please email your contact, and we'll respond to your email once received. Okay, I'm done.
So, hi, thanks, Frederick. So in response to the question regarding a van and the purchase of a van, whomever is asking, I'd ask you to reach out to me, and I will preface it by saying, based on what that van is being used for, is if it's to be transporting children, because we don't pay for transportation, that would be a difficult request coming to DFSS, but reach out to Saratho and I'll try to have a discussion with you about what it is you're attempting to do. Thanks. And can we go backwards a little bit in the slides back to where we are with utilization? And that slide right there. And so again, what you're looking at here in front of you for Head Start, and I know that there's still some final invoices coming in, but we're only up to 69% for the utilization of our Head Start, early Head Start is at 57%, CCP is 59%, and EHS XP 55%. Across the board, that is huge underspend on the federal grants. As I said at the last meeting, I was anticipating more vouchers coming in. The numbers are higher than they were, but we're still riding around a little over 50% for the early grants, and then less than 70% for the Head Start base grant. Again, that's a lot of money that is not being utilized. And these are some of the conversations we're going to be having with all of you on your utilization and what is impacting your ability to use your dollars. Because instead of leaving them on the table, do we need to reallocate? Is there something else that I need to be doing here at this table and in my seat to keep from sending all of those dollars back to the federal government? I do want you to understand from the view of Office of Head Start, if we are underspending and don't need the dollars, then they can reallocate those dollars themselves. They can pull them directly from our grant and decide to use those dollars differently in the region. And so again, I'll be having some conversations with all of you, but I will definitely need to be trying to figure out with you what's going on with your low expenditures, what's going on with classrooms, teaching staff, what is it, so we can get to the bottom of it so that we can make some strategic decisions on the utilization of these dollars. Go to the next slide for the other grants, please. Here we are today, January 19th. We are now in the 7th month of a grant, and we're only 17% utilized on that ECBG grant. Again, same conversation we're going to be having with all of you on your underutilization. If you are not utilizing it, if we're not going to get the dollars out of the door in time, then we need to be much more proactive, and we will, DFSS, be much more proactive in the program year. It is time now in January where we're going to start having some conversations with agencies that are definitely really, really low in utilizing their ECBG grant so that we can make some determinants about what we need to do. We will also be talking about the federal grant because we just started a new one. We just ended one, and I'm trying to get all the vouchers in to see exactly where we're going to be for the utilization for that. But what we can't do is start off this new one where we're on the same course, where we would be really, really underutilizing it as well. So lots of conversations to be had with you about how you're using your funds and why not. Why are you not using your funds? And what can we do to support you? So we will be coming back to you on that. I'm looking at the chat. Not seeing, I see a couple of messages to me that I'm about to respond to. Our finance team said they weren't able to access the vouchering system for PI until October, and they're catching up. Thanks for letting me know. Glad to hear that people are catching up, and I'm asking any and everybody to catch up. If you get vouchers out there, if you've been making payroll, you should have vouchers. Make sure you're getting them all in. No one says that you can only send 1 or 2 a month. You can send more than that a month. Every time you do payroll, send one in. It keeps you in the system. It keeps dollars coming out to you. Everything we can do to make sure people are getting what they need. I do have one question, and I will openly ask the question because I've gotten it from more than one person. What we're trying to do is make sure, because again, I want everybody to understand the child care and adult food program is also it comes out of the federal office. And it comes into states, and then from states into school districts, et cetera, et cetera, et cetera. But even with that said, we have an obligation to understand how children are receiving meals and how the billing is being done. We are in the midst of preparing for an FA1. So one of the things we're asking for is your child care adult food program quarterly report, which you would be doing to show how what all you've utilized, how many meals you served, et cetera. I'm going to try to get my hands on one of those reports, and then I'll send one out to everybody so you can see what it is I'm asking for. And so I've got a couple of people in the chat, and I also received a couple of emails regarding the same thing. So everybody, please hear that I'm going to send something out that will better explain what we're trying to get from you regarding the child care food program. Thanks, everyone. I think that was the last slide. So I'm going to say open it up. If there are any other questions, I've been trying to mine the chat box as well. But if anyone has any questions and want to unmute, here's an opportunity to do that. I know that was pretty quick. We went through all of our slides. And then we'll make sure that you all have it. Anything else from anyone?
Good morning. This is LaShonda from Lakeview. How are you today?
I'm good. How are you?
I'm great. My question.
You went out, LaShonda. You went back on mute.
I apologize. We did have someone from DFSS contact us about our funding slots for the CARES for Salesforce. My question is, we still are unable to do a lot of things within Salesforce because it says we do not have rights to come in to even add a class. So who do I reach out to as related to not having administrative rights to do what I need to do? And would there be another training? Because during the first training, we were unable to we didn't have any information during the summer of 2022 to be involved within the training.
Okay. So LaShonda, what agency are you with?
Lakeview Development Center.
Lakeview, you said that. I was just making sure I got it right. I'm going to make sure, LaShonda, that we get something out to you. Every agency, and what I've been getting from them are all the list of everybody who's set up, and we've been looking at everybody's rights, to your point, because without the right access to it, some of the things you're not able to do. But I will go back, and Stacy Lind, who's on my team, Stacy Lind, L-I-N-D is her last name, at cityofchicago.org. You can reach out to her, and she will definitely work to make sure that the right person is able to respond so that we can get you into the system if you're having any issues. And I'm putting her name in the chat box right now.
All right, thank you.
You're
And
welcome.
my last
Mhm.
question is, do we send you all our PFA attendance? Because you all don't know, like what kids been there, like we keep track of it every month. So should I email that to someone or just wait till we go, or should I just wait until we able to get into the system and, backlog everything?
You can email information to your team lead,
Okay,
okay? But you will most likely have to go in and backdate, but at least we would have the information on hand.
right, because okay, great. Thank you for
Okay.
answering my question.
Thank you. Looks like a couple of other people are saying they're having some of the same issues. I just put in Stacy Lynn, cityofchicago.org. Please email her if you're having issues with access, so that she can reach out to you and help you with that. Kenji, I see your hand is up.
Hi, good morning. So thank you for your team that's been helping us get into CSD Cares. We are making strides in enrolling our children. We did have a question though, because we understand that by the 20th, we have to provide you with some information. And my question is for families that are new, that do not have school mint accounts, or how do you suggest that we enroll families to meet the deadline without having them have to have an account to put them in the system? Is there a way to expedite enrollment for families who are already attending, to get them in there so we can get you what you need for the review?
So as we've said before, the system now for Salesforce, it feeds in through Schoolmint, and that's where the ID for the child is created so that the records can be created across the board into Salesforce. And so we would need that Schoolmint application done for your families, generated, and then it will generate that ID number that will allow you then to input those children. Okay. And so you will need to do that piece first. That's a step that's required.
Thank you.
You're welcome.
I had a follow-up question about that. So when inputting Schoolmint, we weren't able to find our name in the drop-down menu. And because of that, we couldn't move forward with the applications. Is there anything else we can do regarding that?
This is Ray Reed who's speaking.
Yeah.
And who are you with?
Refugee One.
Okay. Okay, let us go in, let us correct whatever that is so that we can fix it so you're not having those issues.
Okay, thank you.
You're welcome. I see a couple of people on here that are saying that they're locked out. Please send that information to Stacy. She will get it to the right people on the team to help you if we're not able, if she can't do it. Whomever else can help with the access, but I just need it in her box so that we can make sure that the IT team and everybody is getting the information that's needed so we can keep track of who's having issues. And so please make sure you send an email to her. And questions about clinics, we do plan to do some other training, some other clinics, some other hands-on things to make sure that people are able to use the system. There's some other pieces of the system that's going to come online. So we're going to make sure, but understand there's always training access through the digital hub where, individuals can go in and just sign up for a training and attend trainings that are already offered through the digital hub. Will there be additional trainings? Yes, we're still working to see what else we need to make sure that you're able to successfully use the system. The question about removing children, we are working with Salesforce on that. And as soon as we know exactly what that process is, because one of the things that happened is someone was trying to remove a child and it literally tripped up enrollment at that site because of trying to remove that one child. We want to make sure whatever that glitch is has been taken care of, and we'll get information out to everyone about how to, and I'm saying archive, because we should be archiving children, not removing them unless there's a reason to remove. And if there's a reason to remove, if they're in the system, again, that record came from somewhere. We don't want to just delete it. what we need to be doing is archiving, because again, these are records that remain for the term that that child is with you, or if they're in someone else's program. So we don't want those records to just go into oblivion, and we want to make sure that nothing like that happens. So we'll be working with everyone on how to archive records in the system. I'm going back in, I'm trying to see a lot of questions about CARES and CARES clinics. Again, I can't say it enough that the digital hub is still there, and I want people to be able to go in, look, and you can always sign up for those trainings that are there. That digital hub didn't go away. It is still there. The trainings are still active, and you can click on them and register and do your trainings. Not seeing anything other than the access ones that I've been looking at. Yes, Tiffany, and I know that's what's happening, and that's the glitch that we're trying to work through. Because what it's doing, and what I'm saying, that child is still taking up a slot at your site. It should not be taking up a slot at your site. It should be moved. And that's the glitch in the system that we're trying to correct. And so as soon as we can get that done, we'll be sending out information on that as well. If anyone needs additional trainings, I would ask that you send that information, and I'm going to ask that you send it to 2 people. Stacy Lynn is one. I'd also ask you to CC Tamela White. Again, if you need training, Stacy Lynn and Tamela White are the 2 that I'm asking you to put on an email and let them know what it is you're looking for. If the trainings are already there, meaning that they're already in the digital hub, we'll direct you. If you're asking for something different, then we need to know what that is so that we can get some prep work done. Anyone else want to unmute? I think I've gone through the ones that are in the system right now. In the chat box. I think I've answered those that are in the chat box, but we will be available to you after the meeting as always. If there's anything that you need, that's what we're here for. We're here in support of you, trying to make your life as easy as we can by taking care of things on our side. And believe me, I know our data system, CARES, is not something that's making your life easy. It's not making mine easy either, because I'm still flying a plane. I think I'm up to 50,000 feet now without wings. So it's I'm coasting there, people. I'm trying to get us there, trying to get this system completed and updated and everything in it. But more so than anything, I just need everybody to have access, everyone to have their classrooms, all their children and information in there and utilizing the system. Because when I go in and I try to pull reports, I'm not able to. Hence, that's why my team is doing a lot of calls and asking for information offline in order to get our enrollment, for example. We're having to come to you as teams outside of the system to make sure we're able to see how many children we actually are serving out there, wanting us to have everyone in the care system so that you will be able to get reports and we will be able to get the reports that we need. And so make sure that you are getting the training you need. If you need something different, let us know. If there's something that's just simply not working for you, let me know so that I can help and I can support. If they're returning children that did not, I see one of those in the chat box. If there's returning children who did not port over when they brought over the children from your site, I need to know what children we're talking about so that we can see if these children were in COPA with everything in there. And then we can work with our vendor to try to bring those children over. But they needed to have a COPA ID. They needed to be in the system. And so we will be working with that to get that done, to make sure that we can pull them over and get them into the system. There is a question, and I'm just going to say this out loud so everybody hears me. Yes, Margaret Jordan is still with CCAP. She's had some personal things, and so I know you may not have gotten an email response from her, But if you send it to her, CC me, I can try to get it to another staff person if you have something that you need with CCAP. I had someone else who had done the exact same thing. Just know that we will support you in getting you to someone who can answer your questions in the interim. Tamela has put her email in the chat. Talked about training. If you want training for your agency, again, reach out. And also, I'm sorry, Nicole, you're on there. If there's a question, Nicole Latimer Williams has also responded. If you have questions regarding CCAP, please reach out to Nicole Latimer Williams, who's the deputy, who will definitely make sure that you can get a response regarding CCAP. Thanks, Nicole, for putting that in there.
Excuse me, Sarethel, I have a question.
Sure.
If I have a staff member who does not have Schoolment access, the rest of them have got it, but this person did not. And we've been going back and forth, but we have not been able to resolve it. Do you have any suggestions?
If this is somebody that has to have it in order to help
Yes.
you do all of yours, then send an email to Stacy Lind so that we can then work with the team on the Schoolment access.
Okay, that's what we've been doing.
Okay, is that who you sent it to for Schoolment access and still not getting it resolved?
I believe it's Stacy Lind.
Okay.
I'm gonna double check that, but
Double
yeah,
check, CC me in the next email.
Okay.
And we'll make sure. She's not the person who's gonna set up the access, but she's the person who can get it to the IT team in order to make sure that we're able to do that.
Okay, thank you.
Oh, you're welcome. I don't see anything else in the chat that we've not responded to either individually or openly to everyone. So I want to thank you all as always for spending time. I know anytime you're on with us for an hour, that's an hour of work that you weren't able to do at your desk. I know some of you're multitasking because you're on a computer and you're probably still trying to get some work done, and I understand that. Again, I know what it is to be able to do this work out there and how difficult it is. We don't take anything that you do for granted. I thank you, as I always do, for everything that you do on behalf of all the children and families that you serve every day. And I'm going to ask you the same thing I ask everyone, is take care of yourself, because we need you. Your staff needs you. Your families need you. We are still in the midst of a health emergency or crisis. We still have COVID, although numbers are coming down. We have also have seen numbers with flu going up, and we also see children and some adults who come down with RSV, all 3 respiratory illnesses. And so we all need to be mindful in doing our mitigations within our systems, our centers, and in our own homes to make sure that we're staying as healthy as we possibly can. We are in the midst of a flu season. The weather is beautiful. I'm saying beautiful. This weather in Chicago is definitely beautiful weather to me. But we also know that we're in January. And so we know at some point we're going to get the weather that Chicago is used to. And so be mindful of all of that. Take care of yourself. Take care of your family. Take care of your other family, which is that family that you are there to serve every day. And know that we're here to support you every way that we can. I am reachable always by phone and by email. And please don't hesitate if you need me for anything. And Stacy's email is in there, but I will put it in the chat box one more time. There you go. So thanks, everyone. Have a great one. Happy New Year. I cannot believe it's 2023 already. I don't know what happened in 2022. It came and it went really, really quickly. So hope everybody is starting this new year off healthy and well, and look forward to seeing you all in person very soon. Take care, everyone. Have a great one.